everyone. It's 10:01, so I'm going to go ahead and get started. I'm really excited to be here today. My name is Ronak Lakhia. I am a physician scientist at UT Southwestern Medical Center in Dallas. I run the PKD clinic there, and I have a basic science research laboratory that studies polycystic kidney disease. So today, we're going to talk about how to navigate the PKD diagnosis process. And this is the QR code for you to send your questions throughout the talk, and then we'll read them and go through them. All right. So I have no disclaimers or disclosures. I already told you a little bit about me. In addition, the PKD Foundation does support a lot of the work that we do in the laboratory, and we're very grateful for that. All right, so the objectives of the talk today are really to talk about how to feel secure that a PKD diagnosis is the correct diagnosis, and to explain how to prioritize information received from the opinions that you've received, and to come up with a plan of what should be your personal medical care plan. How do you start? Who should help you make this plan? And how do you go forward from there? So these are kind of the things that we want to go through during the talk today. So in order to address these objectives, I think we have to take a step back first and think about how were you or your family member diagnosed with polycystic kidney disease. The road that we all take to that diagnosis is a little bit different. And I think many people will identify with them in different ways. And so here are a few examples, and some of them may lie in conjunction with what you've been through, or it'll be a little bit similar. So the first is Jim. Jim was 32 years old. He went to the ER. He had developed really bad, excruciating back pain, and he said the ER doctor told him, well, let's do a CT scan. They do the CT scan, and they find that he has a lot of kidney stones, but he also has a lot of kidney cysts, and he has polycystic kidney disease, and he needs to see a nephrologist. So what should Jim do next? Well, what about Sally? So Sally's 24 years old, so she comes, and she knows that her mom has polycystic kidney disease, so there's a chance that she may have it too. She's been pretty healthy her whole life, has had no real medical problems. She's 20 weeks pregnant. And then during her appointment for that ultrasound, the sonographer comments to her, "Oh, I see one single cyst on your kidney. Did you know that it was there?" So Sally feels that she must also have PKD, and she knows a lot about it already. But she's only 24, and she feels pretty good. What should she do next? One more example. So Yolanda, she's 63 years old. She has no medical problems, has been healthy her whole life. And one day she notices some back pain that's pretty severe. And then when she goes to the bathroom, there's a lot of blood in her urine. So she goes to the emergency room because this is a very scary thing to see. And then the doctor tells her, well, there's some cysts on your kidneys. Maybe that's where the blood came from. And she goes to a kidney specialist who tells her that she might have PKD, but it's not as bad as other people's PKD. So what should she do next? And then finally, Taylor. Taylor is a 17-year-old male. He was in a car accident. He notices that when they do a CT scan in the ER, that he has a lot of kidney cysts on both his kidneys. No one in Taylor's family has polycystic kidney disease. So Taylor goes to the local nephrologist, but he says he probably has it. But he thinks, hey, this is a family disease. No one else in my family has it. Do I really have it? Does Taylor have PKD? So there's a lot of concerns that come with being told of a new diagnosis, and questions too. Was the sonographer right? Does the ER doctor see PKD patients all the time? Does he know how to make this diagnosis? How many PKD patients does my nephrologist see? Are they comfortable taking care of me? Do I need to do anything differently? I feel fine otherwise. Do I need to worry about this right now? I'm so young. And what do I need to know about this finding? And these are often the questions that I see coming to us in our clinic. So what's next? What is the next step that you should do? So to kind of guide us towards this, I've kind of broken this down a little bit to talk about our steps towards understanding your diagnosis. And I think there are a few things that, in my opinion, that would help you kind of gather some more confidence in your diagnosis and feel more confident about your future moving forward. The first is to get a second opinion, and we'll talk about this today. Understand your options and your prognosis. And then to kind of consider what is your health journey, what are your personal goals, and what do you want? And then come up with a plan that works for you individually. So let's start by talking about getting a second opinion. So why should you get a second opinion? there is significant value in getting different viewpoints. If you think about it, we get second opinions all the time. When our car breaks down and you go to the mechanic and he tells you that it costs you $3,000, the first thing you do is you go to the mechanic next door to see how much it's going to cost you, he's going to charge. When your AC breaks down and you want to get it repaired, you get a couple of quotes to see who can do it, how can they do it, and which way works for you. And so just like that, in your medical diagnosis, there is value in understanding viewpoints from different types of doctors. So you may have seen a local kidney doctor, a local nephrologist who tells you that you do or you may have PKD and there's not that much to do, or that they don't know too much about it. Perhaps you should see someone who sees this all the time. This is their bread and butter of what they talk about and see every single day. And can that person give you another viewpoint, or can they make you feel confident about what your first doctor told you so you know what you have that you're carrying with you? And believe it or not, there's actually research looking at the value of a second opinion. So this is one study that was done at the Mayo Clinic in 2017. They looked at several hundred individuals that came for second opinion specifically, and what their diagnosis was that they came with, and what was the diagnosis that they left with afterwards. 66% of the individuals that came for a second opinion left with a redefined or a refined diagnosis, and 21% came with a new diagnosis. So this should build your confidence that there's nothing wrong with getting a second opinion. In fact, that may help kind of more fine-tune what you really have. Finally, one of the concerns I often hear is that I really liked Dr. So-and-so, they were just so nice. Can you not tell them that I came to see you because I really don't want to offend them? Truthfully, don't worry about offending your doctor. In fact, most doctors are more than happy to send you to someone to see as a specialist. It will build confidence in their own management, and they can help facilitate making that contact. You can actually create a system where they communicate back and forth, and they're more than happy to send you to someone else to get that second opinion. And so I would never worry about that as a concern or a hesitation of why you shouldn't get a second opinion. And then finally, I think it's important not to ignore cost for our patients. Most insurances seem to pay for a second opinion with a copay, but not all of them do. So if that is also something you need to keep in mind, check with your own provider. And if that's not going to be something that's feasible, call the clinic of the second opinion and see what they can help facilitate so that you can actually obtain it. So who should you seek out for this second opinion? You saw your local nephrologist, you saw an ER doctor, or because someone sort of told you had some cysts on your kidney, and because your family has it. So there's a few ways that you can go about this. You can ask for a referral from that initial physician. Oftentimes they have the contacts available to send you on to the next person. The PKD Foundation actually has a great resource that you can use. There is a list of centers of excellence and partner clinics that have physicians that are specifically very experienced in polycystic kidney disease, or they are very interested in learning more about polycystic kidney disease, and that list may be very helpful to you to find that person that would be a good fit for you for a second opinion. You can look at where they're located. I know not every state in the United States has a center of excellence, so you may need to look at see what's close by for you. You can look up these individuals. They have their biographies. You can look up many of them are at academic institutions. See who you think you want to go see. And then make that appointment and let them know specifically that you're coming for a second opinion. As a physician, it's always very helpful to me when I am looking at my patients that are coming in for the day. Why are they really coming? Are they coming because they need to get diagnosed for the first time, or do they already know and they have a list of questions and they really want to know why? And that helps me prepare so that way I can help provide the best possible care on the given day that we have that appointment. So what do you do before your appointment? So these are a few tips that I would recommend. At this point, when you're going for a second opinion, you have a series of questions. There is some knowledge that you've had. I'm sure that you've probably been to the internet and looked up things about your new diagnosis. So write down all of these questions and concerns because you need to do your homework and be prepared. And try to send them to the doctor beforehand with the expectation that they're not going to answer these questions before you come to the clinic, but that way they know what you're looking for and can help prioritize what that visit should look like for you. The more that the physician has beforehand that they can kind of look at, it really makes for a very productive visit. What else should you do? Make a list of your medical history, all of your surgeries, a list of all of your medicines. And although you may feel that you know all of these things because this is you, I think that oftentimes, even me being a patient, I forget because I'm nervous when I'm seeing the doctor. I don't know what they're going to say to me. Maybe I didn't quite understand, And so if you have it all written down, you know that you're not going to forget to mention any little thing. And when you walk out of there, you've given the doctor everything that they need to do. And then finally, most importantly, bring your records from your other physicians, doctors, tests that you've had done for your second opinion with you, and preferably try to see if they can be sent over ahead of time. For example, I often see individuals that come for the second opinion. Do I have PKD? I personally don't trust the radiologist's paper-written report that says that has polycystic kidney disease. I want to see the actual pictures. And so if you come to me with a list of papers, but no CD or no imaging, all I can say is, well, based on the report, it sounds like you do, but I haven't seen it, so I can't confirm. And there's always one or two bad stories out there where PKD is not really PKD, or the radiologist is wrong. We're all human. We all make mistakes. So if you can bring that imaging with you, or if you can have it sent over ahead of time, that's fantastic. In fact, many of our centers actually actively work to get these records in and not even make an appointment until we get those records in so we can have a very productive visit. So how do you prepare for that appointment? Other than writing everything down, taking all your notes, think about who you want to bring with you. Do you want to bring a family member or a friend? You may be nervous about this. You may not know what they're going to say. You may not hear everything because this is new and overwhelming, and if you're nervous, bring someone you trust, someone who may have a different viewpoint, someone who's going to be your advocate for you. So what are the goals of that appointment once you come to that appointment? You want to confirm your diagnosis. You want to look at what is your potential prognosis and what is that plan of care that you're going to walk away from today. So how do you prioritize what you're going to hear at that point? So you want to ask a few questions. You want to know, do I have PKD? That was your first question. Do I really have this? Ask, how did you confidently make this diagnosis? What criteria did you use? Is there any way I would not have PKD and this is something else? These are very important questions that you should ask so that way you can feel comfortable knowing that the physician that's diagnosing you has a logical reason for saying that you have polycystic kidney disease. Not everyone is a doctor, not everyone is in the healthcare field, but there are ways that the physician can explain in a logical way that makes sense that you should be able to understand, well, my doctor says I have PKD for these X, Y, and Z reasons, and this is exactly why I have it. Or one doctor said I had polycystic kidney disease, but now the specialist who sees this every day is saying I don't, and this is why they're saying they don't. Or one doctor says I do, but the new doctor says I may or may not, and these are the reasons why I may or may not. And I think that building that confidence of knowing what you know, what you don't know, will help you become much more comfortable of what is your diagnosis and how do you move forward from there. So that was your first question, do I have PKD? The second question is, what should I do next? How do I come up with that medical care plan? Are you going to help me come up with that plan? Is someone else going to help me come up with their plan? Or is there going to be a team of doctors that helps me come up with this plan? And then finally, what is the most important thing you think I need to know to understand today? So this is something that you should ask at the end of the visit. Oftentimes, you're inundated with quite a bit of information, a lot of education about what is the disease if it's very new for you. And then at the end of the visit, you may be overwhelmed with what do I take away from this? Was it this? Was it that? What is this? And we realize this. We realize that we often inundate with quite a bit of information. And so you can ask, what's the one thing I need to know today? And what is the rest that I can work on learning as I deal with this diagnosis moving forward today? Don't be shy. This is the most important thing. If you don't take anything away, is do not be shy. Understanding will build your confidence, and you should ask the meaning of all these medical words. Many times I hear that I know more about PKD than the doctor who told me that I had it. And then and patients will come in having read about their diagnosis, and you all are very, very smart, and you come with a set of jargon that you've already learned. And sometimes you can get lapsed as a physician or a healthcare provider thinking that this person understands perhaps maybe a little bit more than they do. And so don't be shy if we start talking to you in a language that doesn't make complete sense. You know, say, what does that mean? Make sure that you feel heard. If your question was not answered, that you don't understand it, just ask it again. Say, Dr. So-and-so, I didn't quite understand. I think this is what you said, but can you tell me one more time? You know, and it's very, very important not to be shy. And then you want to understand your prognosis and your options. So remember, only 50% or about 50% of individuals with polycystic kidney disease develop kidney failure. But that doesn't mean that the other half of individuals don't develop problems with their kidneys or other problems with their other organs, or that it is not a significant disease. And one of the first questions when you're diagnosed, when you see the statistic, is which group do I fall into? Do I fall into the 50% that's going to develop kidney failure, or are you going to fall into the 50% that's not? And how do I know that? So ask that question. Do you know what my disease course may look like? We have tools to measure the kidney size and determine how aggressive this disease. So if one of the things that I often share with my patients is that you're born with this disease. You have it your whole life. Yet when someone checks your blood work, your lab numbers and your kidney function looks normal for a very long time for many individuals. And at some point, you fall off this cliff where your kidney function starts to decline. Meanwhile, your kidneys have been growing in size this whole time. So where is this cliff going to happen to you? And we have tools to help predict that now if you have autosomal dominant polycystic kidney disease. And that's something that definitely should be addressed at your visit if you have ADPKD, is what is your prognosis? Do you have rapidly progressing disease, or do you have slow progressing disease? If there's anyone in the audience who has ARPKD, we don't have specific tools just like this that we do for ADPKD, but our knowledge has increased regarding specific mutations, types of mutations, and your pediatric nephrologist will likely be able to help you, to guide you, to give you some idea of what they've seen and what they know and what is known in the literature, to give you some idea of what your prognosis may be for your children or young adults. Understanding your outcome and options. So what about my treatment options? Now, you told me my diagnosis, that I do have polycystic kidney disease. You helped me come up with my prognosis. Which half do I fall into, and how fast is this going to happen? What are my treatment options? That's the next step. So right now, there's only one FDA-approved drug for polycystic kidney disease. Do you qualify for this drug? You should ask this question if it's not brought up to you. And if you don't, or you do qualify, why do I qualify? And what will that drug do for you? How much time will it buy you? Can you predict what do I need to do to be on it? Ask about other options not directly related to polycystic kidney disease. At this point, you've probably learned that individuals with kidney disease have multiple other problems sometimes, such as high blood pressure, anemia, things, and there are targets for that we want you to achieve. Ask about those things. Is there a specific diet that I need to follow? These are all questions that you can ask that should be brought up by your provider, but if they're not, that's something that you can come up with to make sure that you have a list of questions that you have. Bring the news that you've heard. If many of you read about on the PKD Foundation's website, other literature, research articles, I often have patients bring me primary publications from studies that have been done in mice about polycystic kidney disease that have come out, clinical trials. Ask them, what is new, what is upcoming? I think this will help build your confidence that there are individuals in the country, in the world, working on this disease, and that builds your power to know that we are moving forward. It brings motivation to the physicians, and many of the individuals, or if not all of them, that you see as a second opinion are experts in the field and not only perform the basic science research, but they also perform the clinical trials. They know what's going on. They know when things will start and when things will end and when data will come and what did it show. And having that information will be useful to you to know that there are new treatments on the horizon. What is the status? How long do I need to wait? I think having more certainty builds a little bit more confidence. And I think also it builds a great relationship with your provider as well. If you know a little bit, you can ask about it and then move forward from there. What happened to it? How can I participate? Should I participate? And then finally, remember that your disease is not just confined to the kidney. The manifestations of your disease will be different than others with the same diagnosis. So remember, you can have liver cysts. You may have significant pain. You may need a kidney stone expert because you have kidney stones, or a urologist. You may need a cardiologist if you have defects with your valves in the heart. You may develop pancreatic cysts. Some of you may have hernias. You may need a neurosurgeon to take care of the cerebral aneurysms. And so your team of doctors may consist of more than just one particular kidney specialist that deals with polycystic kidney disease. So when we come to this plan of care, all of these things need to be part of that plan. So who needs to be on your healthcare team? Because I just told you that there's a slew of other complications that you may potentially have. So who needs to be on this team actually? So this is what I would suggest. I would suggest that on your team you have a PKD-focused nephrologist. If that person is close to you, that could be your primary nephrologist. But many of you do not have a PKD-focused nephrologist close to you. So a local kidney doctor or nephrologist will be key to help you coordinate your care when you can't always go see that PKD-focused nephrologist. A primary care doctor, this is one of the most important things, that you have a PCP that you trust, that knows your diagnosis, but is comfortable taking care of all of your other medical problems and helping to work with that PKD-focused nephrologist to help take care of small issues that may come up. And then you need a series of family and friends. If you were at Missy Franklin's talk earlier today, she talked about how having a support team was very important, and that you need a village. And that's true for anything that we do, and you definitely need a village for this. And so they need to know what you have and what to look out for. What about all those other specialists? Well, it really just depends. The list is very long, but I don't think that everyone needs every single one of these doctors. And it will be your PKD-focused nephrologist that will help you decide who do you need them and when.